Hi, this is Shambhu from bestprepaidcellphoneplans.com, and today I'm going to talk about the Jitterbug LiveNurse service, which provides nursing advice on your cell phone. So what is it? The Jitterbug LiveNurse service gives Jitterbug owners 24-hour access to live nurses for tailored health and wellness advice. This is technically known as phone nurse triage. And the service is free on all Simply 29 and higher plans. You just pay for the airtime. If you have one of the lower plans, you can pay $4 a month to add the service. With the service, you also get free access to an audio health library. Now, you should, of course, always call 911 in an emergency, and in fact, if you call up the LiveNurse service, they'll probably tell you this again on the phone as well. So how does it work? The nurse service is actually provided by PhoneMed. It's a company based in Colorado Springs, and their nurses are located in the US and Canada, with many of them in Newfoundland. So you don't have to worry about being able to understand them. They're trained to understand you. And this area of nursing again is known as phone nurse triage or telephone triage. And so what happens is that during a call, the nurses do not actually prescribe or diagnose your problem, but what they do is they go through your symptoms, starting with the most acute down to the least, and recommend the next step to take, whether it's making an appointment or going to urgent care. When they do this, they follow a standard protocol known as the Schmitt-Thompson protocol. And this protocol provides the questions and follow-up questions that the nurses should ask and the advice they should give. You've probably already experienced this if you've ever called for nursing advice in a doctor's office. There are actually two sets of protocols, one for children and one for adults, and of course in this case they will be using the one for adults in most cases. The advice is tailored to you. It takes into account your age, gender, height, weight, etc. And all this information is maintained in an electronic chart so that your previous calls can be taken into account as well. As you can see, this is a specialized area and requires specialized training. PhoneMed requires their nurses to have at least 3 years clinical experience and 1 full year of phone nurse triage experience. So what happens when you call? You're first connected to a customer service representative who will collect or confirm your identity and demographic information. And this representative is also required to have 1 year experience. Then you and your info are passed on to the nurse who will advise you. So why you may need this? This service has a few advantages. One is a peace of mind. You know that you can get professional advice from a trained nurse at a reasonable cost wherever you are and whenever you want. You can save time and money by avoiding unnecessary trips to the doctor or urgent care. And when you do need to see a doctor, you'll know that you're doing the right thing. And so how can you get it? If you're a Jitterbug owner, you can sign up for the Jitterbug LiveNurse service by simply calling customer support and asking them to add it. And they will do that automatically through your phone. I hope you enjoyed this, or at least found this useful. And if you want to know more about cell phones, you can go to bestprepaidcellphoneplans.com and take a look around there. Thank you.